Hello, everyone. Today we will be discussing CPT codes. CPT codes are used by many different healthcare facilities. Some of the healthcare facilities that use CPT codes are clinics, hospitals, rehabilitation units, ambulance services, long term care, just about anywhere where healthcare services can be provided, CPT codes can be used. They can be used for outpatient services for physicians. And when these services are used for physicians, they're normally going to be billed out on the CMS 1500 claim form. So these are the major areas of the CPT coding manual. The first section is going to be your E&M section. This is going to be for your visits, so your office visits, your hospital visits, nursing home visits, critical care visits. So any type of visit is going to be found underneath the evaluation and management section. Next, you have anesthesia. So all of your codes that are used by the anesthesiologist is going to be in this section, and this is mainly going to be for whenever a patient is getting a surgery. They're normally going to be receiving anesthesia, and those codes are normally going to begin with 1. So the next section you're going to have is the surgery section. So this is going to be, of course, any type of surgical procedures that the patient may have. The next area is going to be radiology. So this is going to be for your x-rays, your CAT scans, your MRIs. So normally these codes are going to begin with the 7. These are going to be in the 70,000 series. The next section is pathology and laboratory. So these are going to be anything that is removed during surgery, and the doctor has to send it off to the lab to confirm any type of disease. So they'll do testing and we'll use pathology codes for that. The next section is the medicine section. And this section is normally going to begin with the number 9. And you'll have a variety of codes in this section. Then you have your category 2, 3 codes, your appendices, and your indexes. So these are the different sections of the CPT manual. So here's an example of the first section, which this is for our E&M section. So this is an example of the new patient visit. It's the 99202. So this code can be used as outpatient office. So this is going to be a patient who has not been seen in the office in the last 3 years. We can actually bill them as a new patient if they come in that say they haven't coming in 4 years. Now we can use a new patient code. So these codes are normally going to be reimbursed higher. So you want to make sure that the patient is new and that they have not been seen in the last 3 years. The next section is the guidelines. So each areas of your CPT manual is going to have guidelines in it. And in those guidelines, it's going to tell you how to use the codes in that section of your CPT manual. So here's an example of surgery guidelines. So you'll have guidelines at the very beginning of the section, and then you'll also have guidelines that are within the surgery section. So, for example, this section, which is at the beginning, and it's letting us know that items in this section can be used for reporting all physician-related services, and also some other commonalities are repeated here for convenience of those physicians referring to the section of surgery. Other definitions and terms that are unique to surgery are also listed here in this section for the surgery guidelines. So again, they'll be at the beginning of each section. Here's an example of some notes that are throughout these sections. So this note actually talks about surgery of the skull base. So actually, it's giving us some additional information on things that we need to look for when we're coding in the surgery section, and it's giving us some additional details. So when we actually go to start coding in surgery, the first thing that we want to do is we want to look up the procedure or the service inside of the index. So in the index of your CPT manual, it's going to tell us where to locate that actual code. So we should never use this section to actually assign a code. It's there for us to look up codes, and then it'll tell us where in the book we're going to find it. So this is a screenshot of the index. So basically it's telling us that we're in the repair section, and the next section is iris. So repair of the iris. And then if you look underneath, it's telling us iris is giving us a code there, suture, and then there's also a range of codes that are listed underneath. Then on the other side, we have repair, and then we have toe. And then we have toe muscles, and then it's giving us a code in which they want us to now go and look up in our CPT manual. So again, it's just telling us where to look in the manual. It's not actually giving us the actual code that we need to use, because we're not going to find that additional information about the code inside of the index. So we always want to make sure we're just using the index just for what it is, to tell us where to look in the actual CPT manual. So I've put some guidelines here because sometimes students will ask, well, what are some things that we need to think about when I'm going to actually start assigning the code? I don't even know where to begin. So here are some things that I put together that can help you decide on how to choose a code. So first of all, we want to know what service was provided or what procedure was actually performed. So that's the first thing we want to know. So did the patient come in for an office visit? Did they come in for a chest x-ray? So we want to know, why is the patient there? What was the main procedure or service that was performed? Was there anything that was additional that was performed? So was there any additional services that was performed while the patient was there? So for example, the patient could have came in for an office visit, and then the doctor said, okay, medical assistant, can you do an EKG on this patient? So even though the patient wasn't scheduled for an EKG, we're now going to do an EKG. So that is something in addition to the office visit. So that's what we're referring to when we say an additional service. Next thing we want to look at is, what is the age of the patient and what is their gender? Because we have some codes that are age or gender specific. It will say it in the description, the patient's age range, or it may say something about a gender. So we can look at that as well. Now, for our surgery section, so that's what we're referring to when we are talking about procedures. We want to look at what method was used, what instrument, and what approach. This is mainly going to come in the surgery section. And you could have 3 different codes for the same procedure, because it could be a different method, a different instrument, or a different approach. So that's why we look at those things. What anatomic site was treated? So was it the head? Was it the arm? The leg? So we want to look at what part of the body was actually being treated. We also want to look at what quantity was provided or time spent. So you have some services that are coded based off of quantity. So one of the areas that looks at quantity is, for example, a patient came in, they had a skin tag, and there's codes that may say this code will cover 10 skin tags or less. Then you may see another code that says 15 skin tags or less. So that's one where we're looking at quantity. Then you have ones that look at time. So critical care is one that looks at time. how much time was actually spent with that patient, and that is going to help us to determine what code will be assigned. So you have some that look at time, some that look at quantity. Another thing we want to look at was there any complications or was there anything that was unusual that happened during that patient's visit? So one of the things that you can think about as an example is a patient comes in, they have a colonoscopy. That's what they're scheduled for. They get the anesthesia, they're in the back. The doctor starts the colonoscopy, but for some reason they aren't able to finish. So, because they aren't able to finish, we'll stop the procedure. We still can bill for that service even though we didn't complete it, but we'll have to add a modifier to say, insurance company, we still provided the service, but we weren't able to finish. So that's why you want to think, was there anything that was unusual? So that's something unusual. So we need to think, okay, well, what else do I need to do? That's going to trigger in your mind, okay, this is not a service that was actually completed. So what is something that I need to think about? So you'll add a modifier in that case. Another example is, was more than one provider involved? So some surgeries could have more than one provider. You could have a cardiologist and a general surgeon, for example, for different procedures. So that's what we're referring to when we say, was there more than one provider? And then the next thing we want to look at is, what was the final diagnosis? Because the final diagnosis can be different than the diagnosis when the patient first came in. So that pre-diagnosis could be different than the post-diagnosis. So that's what we're referring to. So in terms of billing and coding, we want to always use that final diagnosis. So now we're going to go and look up our code. So how do we find things in the index? So first thing we want to do, research the procedure in the index. How do we do that? We're going to identify the main term or the procedure or service name or the organ or anatomic site or the condition, synonym, or abbreviation. So any of those variations we can use to find the main term for that particular CPT code. Once we look up the code in the index, once we get there, we'll look to see, are there any modifying terms? Are there any instructional notes located under the main term? So we want to look for any additional information. So after we found our code in the index, we're not going to assign the code at that point because we should never code from the index. We should just use the index for what it's designed to do, and it's designed for us to then go into the tabular list to find the correct code. So we should never be coding from the index. So we'll verify that code in the tabular list. And in the tabular list, this is where you're going to find that additional information about that code. You're going to find any additional instructions, such as guidelines on how to use that code, any special instructions, any instructional notes, any symbols that are at the bottom of the CPT manual. You'll find all of that in the tabular list. You will not find it inside of the index. So that's why we want to stay away from coding from the index, because we're going to miss valuable information. So we need to make sure we're not coding from the index at any point in time. So before we actually assign the code, I always tell students, refer back to that original documentation. We want to make sure that we have the correct code. So take a couple extra 10, 15 seconds just to say, okay, let me make sure that this patient actually got a 2-view chest x-ray before I actually assign it. So make sure everything matches up, and then you can assign the code. So you want to give your myself the opportunity as that final check to make sure I got everything correct. Because we want to make sure that the code that we are assigning matches the description next to that code. So the code and the documentation should always match. So we want to make sure that we're doing that. So I have an example here that I'd like to share with you just to give you an idea of how it's going to work when you're assigning a code. So this particular patient, they came in to the hospital and they came in through the emergency room because we have it here. We see it says emergency room record. Our patient is Rebecca Jones. And then it will tell us her initial assessment when she came in was she had nausea and vomiting. So this, I would say, is the pre-diagnosis, nausea and vomiting. But we know we should not be assigning codes based off of that because the patient can go through that course of treatment and that diagnosis could actually change. So we'll read the rest of the note where the physician treated the patient and what exactly happened. The patient was there for 4 to 6 hours. Doctor talked to them, asked them questions. They didn't have any more pain. And the patient was just given IV saline for rehydration. And there was no further episodes of any nausea and vomiting. And so the patient was just instructed to follow up with their physician once they were discharged. And so we look at the final diagnosis, and it is acute nausea and vomiting, probably viral gastritis or food poisoning. So even though we're not focusing on ICD-10, I just want to bring this out because it's all included in this record. We noticed that this patient, the doctor has mentioned probable viral gastritis or food poisoning. We should never code anything that says probable, rule out. Um, we don't ever want to use those type of codes. So we're going to code the nausea and vomiting. So just to keep that in mind, we never code anything that says rule out, suspected, things like that. We want to just then defer back to the signs and symptoms because we don't have a definitive diagnosis. So even though we're not doing diagnosis, I just wanted to add the diagnosis code in. So for this particular procedure for nausea and vomiting, unspecified, it'll be the R11.2. Now for the visit, which that's what we're focusing on, is for CPT, and this patient will get the level 1 99281 for emergency room visit for evaluation and management of a patient that may or may not require the presence of a physician or qualified healthcare professional. Now, this is the description that is in your actual CPT manual. But this patient didn't get a lot of services done. It was really very minimal care. So that's why we're going with the level 1, the 99281 emergency room visit. So I hope that some of those tips will help you as you are starting to learn CPT. And so I've put the diagnosis here just in case for some of you guys who want to look that up. That's R11.2. And then we assign the CPT code 99281. So this is going to conclude this session, and this is just a quick overview of CPT coding and how to apply CPT codes utilizing your CPT manual.